Welcome back from your virtual lunch, walk break, or the panic of getting as many emails out in a matter of a few minutes as necessary before your next session. It's great to have you with us here this afternoon for a very insightful conversation with leaders on the local level responding to big challenges with great solutions and bold ideas. I want to start off with just kind of a reference of a quotation I discovered recently, thinking about these times in the year of 2020. In the words of Albert Einstein, the measure of intelligence is the ability to change. And if we think about how much changing we're doing this year and really changes the theme, we've got a very brilliant panel of speakers from their perspective, sharing their wisdom, experience, and also vulnerability on the challenges that 2020 has presented to all of us. Our focus for the panel today is the impact of COVID-19 on the local level. And we're very fortunate to have with us 5 distinguished leaders leading at the community, regional, and statewide levels. We'll begin with Mayor Goodwin, then Ms. Anne Bowling Tuckwiller, Mayor Rappold, Ms. Janell Ray, and Mayor White are our 5 panelists. I'll do a brief introduction, but I ask you to look at the conference website for their full bio of their great distinguished work across West Virginia. One thing I'll mention is that we were talking before this, is that today is the anniversary from 1863 of Lincoln delivering the Gettysburg Address, and Mayor Rappold from Beckley won the competition that if we want to recite it today, he'll be happy to do that for all of you. But thinking about the quote from Einstein, but also the quote from Lincoln, is how those challenging times come up with great innovation, great practice, great solutions. But also it's not restoring normal, it's taking us to the next normal, because not everything was great in the old normal. And so these leaders are going to share their impact, their focus, and their work. So with no further delay, I want to introduce Mayor Goodwin to share from her perspective at the great city of Charleston. Madam Mayor.
Paul, thank you, and thank you to the entire panel. It's an honor to be with all of you, and thank you so much for including me in today's events. I am coming from my office live to you here in the capital city, in the city of Charleston. You know, I've only been mayor less than 2 years. I don't know if many of you have seen the meme of, you know, when you were running into 2020, you felt great, and now that you're in 2020, what it actually feels like. My first year as mayor, with our boots on the ground in a new administration after 16 years, we were burning the candle at both ends, and we were looking at making some really great positive changes and had a lot of momentum. And then COVID, which is so much like so many of our other guest speakers today. You know, on March 16th of 2020 was the day that I signed our first executive the executive order declaring a state of emergency, the first city in the state of West Virginia. You know, because being the capital city, being the seat of government, being, you know, the center of a lot of our robust business here, we knew that it was going to hit not only Kanawha County, but the city of Charleston extremely hard. I have 750 employees in the city of Charleston. I run a $100 million budget, the largest in the state. And the one thing that was, you know, so challenging for me, and I'm excited to hear from other mayors as well, is what makes an essential employee? How do you define yourself as an essential employee or not? I think we're all essential employees, but I think what you'll hear from so many of us today, from mayors and city managers and others, is most of the folks that we work with are all essential. We run fire departments, police departments, refuse, sanitation. So when you look at who can work from home and who's an essential employee, that was our largest and biggest challenge that we had here in the city of Charleston. We can't send police officers home to work or firefighters home to work. So we had to be innovative and we had to be nimble. That was the thing when we first, right after that executive order that I signed, we met with all of our team leaders and all of our directors to say, okay, How are we going to continue to be able to do our work, your work, on behalf of the people in the city of Charleston? Some folks could go home, some folks could not go home. And what did that look like? So I wanted to bring that up as a, I think sometimes people think government, it's, we're all home, and so many of us have not left City Hall or our police stations. We've been here for the X amount of time that that COVID is going on. But, this is what I know to be true now more than ever. I thought this before, but now I believe small towns are really nimble because we're used to being nimble. And I think it's really helpful that we are. I think that we can be much more responsive than even some of our larger counterparts. I have the good fortune of being in the U.S. Conference of Mayors, and we're on conference calls weekly talking about innovative ideas and what we can do. I mean, don't get me wrong. I think that we've come up with some great ones, and I'll share those with you today. But we've looked to our bigger cities in other states for advice, and smaller cities to share knowledge and to ask them, what are you doing and how are you troubleshooting and how are you problem solving in your community? Because if anybody knows the state of West Virginia, you know that there are some challenges that the Eastern Panhandle has that Southern West Virginia does not have, and vice versa. So sure, we're adapting to this diversity. We take lessons from elsewhere, and we've also done this. We've embraced the things that we know we're really good at and the things that we're known for. We're called the Mountain State for a reason. We have more trees than we do people. in a pandemic, that's a good thing. And so a very quick story, and Paul, you can cut me off and hit mute when my time is up. But my husband and I were biking up a carriage trail. If you're familiar with the city of Charleston, it's a wonderful trail that goes from South Hills to downtown. And when we got to the top, he saw a young woman standing there. And he said, "Oh, Holly, I thought you were still in DC working at the law firm. Are you visiting your parents?" And she said, "No, I moved back home. I moved back here because the work that I can do in DC, I can do here. And what the pandemic showed me is that I can have both." And then she introduced us to her friend Sally, who is now living in the city of Charleston and has moved back, or moved from DC to Charleston. So make no mistake about it, we've got so many challenges, but there are those success stories. I get asked a lot, what are you going to do? You've just built a $110 million Coliseum and Convention Center. How are you going to fill it when we're trying to keep people separate? Kevin Costner was kind of right, build it and they'll come. I'm not sure that he knew that there was going to be a massive pandemic along the way. But what we're doing is we are being proactive. We're looking at 2021 and 2022, the end of, because I think everybody is wise enough to know on the call today that we're not out of this anytime soon. And I think that we have to continue to be in that mindset and look towards the future. My grandfather was a marathon runner back in the day, and he taught me how to run, which sounds silly, right? You don't need to learn how to run, you just run. Well, there's actually a strategy of running and running well. I used to look at my feet, and he used to say, that's where you've been. You've already covered that area. Look in front of you, look ahead of you. The last thing I'll say, and I'm interested and so excited to hear from the other panelists as well, is that I also have a different perspective as being mayor during this time, because I have a 16-year-old and an 18-year-old, two boys. And Joseph, the first time I saw Joseph's face was September 11th, 2001 in an ultrasound at 9:03. It was captured at that exact moment. That's where I was. And it sits on his desk in his room still to this day. And it is a reminder then and now that what this generation and what they have gone through, my 18-year-old, soon to be 19, what they've gone through is a true test in resiliency, right? is a true test in how you adapt, how you are managed through, and how you manage yourself through these difficult times. But I'll say the generation that is growing up, that grew up in the September 11th day to now, we're going to be following them, and we're going to be taking, a lot of our small and larger cities are going to be taking a cue from them as to where they want to go and the type of things that they are going to want. And fortunately for us, densely packed, big cities are not on the agenda. And I think that for the first time in a very long time, I think those of us who have grown up and live and are raising our families in the mountain state see clearly now this is certainly an opportunity for us as we move forward and we keep our eyes on the pathway ahead of us. Paul, thank you so much.
Thank you, Madam Mayor. Great reference. I just want to come back and pull out a few points there. You started off and closed out with such a good reference to this is a marathon, the experience that we're all learning to run and improve our practice. It's a long haul, it's not a sprint. We're also looking from the standpoint of how nimble and effective small cities and towns can be, also smaller organizations, smaller foundations. And then talking about the unique opportunities, there are challenges, but there are some unique opportunities. You referenced the ability to bring young leaders to the table to help shape what the future will look like, and additionally, people moving back to the region and telecommuting with their class experience. So just remarkable. So thank you so much, and we'll have some questions for you just a little bit later. I want to pass on, so we're going to go from the public space, our government space, our largest city in the state. Another sector that's very actively engaging right now is philanthropy. And philanthropy are a number of different institutions: community foundations, private and family foundations, healthcare conversion foundations, corporate giving, really responding in a very unique way, a very important way. And so we're fortunate to have with us Anne Tuckwiller, who is Executive Director of the Greenbrier Valley Community Foundation. And so Anne, I'll turn the floor over to you.
Yeah, thank you so much, Paul. Thank you all for the opportunity to share my experience with COVID. I can say that responding locally has been made a lot easier with the support of Philanthropy West Virginia. So I'm thankful for Paul for that and for including me today. From a philanthropic standpoint, the Greenbrier Valley is very unique. We have a significant percentage of seasonal residents who are in very well philanthropically positioned. And so, unfortunately for the Greenbrier Valley, disaster relief is not totally new to us. Everyone in this room, being Southern West Virginia residents, probably was touched in some way or another by the flood in 2016. Greenbrier Valley was particularly hard hit, especially White Sulphur Springs, which I happen to be from and lived there at the time of the flood. And when you hear people say that it looked like a war zone, that is not an exaggeration. It was shocking what happened to our town. And we were really unsure that we would ever recover from it, really. And so White Sulphur is a unique place in that most of the town works at the hotel where many of these folks live and visit part of the year that really have the opportunity to give. And the flood was the first time that a face was put to that disaster. So maybe a resident of the sporting club, the woman that waits on them in the main dining room every Friday night, maybe lost her home, or God forbid, a family member. So for probably the first time, the sporting club and Greenbrier visitors had a face to a name and really created a relationship with them. And they immediately stepped up to help with disaster recovery following the flood, which really set a foundation for how we responded during COVID. The other element that carried over from the flood was the collaboration between the Greenbrier Valley Community Foundation and the United Way of the Greenbrier Valley. So for those of you who are familiar with community foundations and United Ways, our roles overlap a lot in a community. How can we help the communities we serve and fill the needs that are most pressing? So our organizations collaborated during flood recovery and set the foundation to be able to do so again during COVID. So as soon as, actually we share office space. I mean, we work really closely together. And so immediately, once the announcement was made that schools would be closing down and the writing was kind of on the wall of how serious this pandemic is, we immediately got together and said, what is our role in this? And it was undoubtedly that of funders. We had so many organizations that were really going to be hurting, nonprofit organizations and service orgs that were really going to struggle with this. So we quickly came together, and I'll say for those in the philanthropic space, realized were some of the most important elements of philanthropy that we discuss over and over is the importance of transparency and the importance of stewardship. So because these donors that donated to flood recovery had trust in how we would manage their money and how we would effectively fill their goals of their donations, they were very confident in supporting our COVID relief fund. And because we kept in touch with those donors over the past 4 years and really knew what their interests of funding were, we were able to direct them in the right place. For example, if I had a donor in flood recovery that wanted to help contribute to Brad Paisley Community Park, a park that was built in one of the flooded areas, I knew that that donor is probably someone that would be interested in the projects we're doing to serve children during COVID. So really knowing your donor and knowing what type of impact they want to have. So we quickly came together, and within a couple of months, because of these relationships we had built in 2016, we had raised about $215,000 to date. And part of that is through the Take 5, Give 5 program that Philanthropy West Virginia hosted. And we were really blown away by the support from both our community members and our seasonal residents. We quickly identified the main areas of need being food service. Every school in our 3-county region is a Title I school, meaning at least 40% of students are low income. Anecdotally, I would argue that Mayor White can say many of our communities probably have a much higher percentage than that. So we knew that a lot of students had their most consistent access to food was school breakfast and lunch. So we knew that was going to be a huge hole to fill while school's out. Similarly, seniors with food access issues. Of course, they were not relying on school lunches, but being a vulnerable community member, they're going to be hesitant to go to the grocery store or the pharmacy and pick up the things that they need. So students and seniors with food service organizations were top priority for us. We funded every food bank in our region with the exclusion of 2 because they said, we don't need it, give it to someone that does, which again is a testament to Southern West Virginia and how we take care of each other. Secondly was, of course, first responder support. We helped local EMS purchase PPE. Monroe County, one of the counties we serve, had a big outbreak in the summer at their senior living center. So we helped them purchase, the Monroe County EMS purchase large-scale sanitizing equipment for their emergency vehicles and county facilities. We helped set up a mobile testing site. Really just any way that we could help first responders get the work that they need to do done more efficiently. As we all know, they've been the backbone of this pandemic. And finally, virtual education support. You know, at-home learning is all well and good for children that have in their home the resources and accessibility to be able to do that. But that's just unfortunately not the case for everyone in Southern West Virginia. Pocahontas County is in our service region. As many of you probably know, that there's a big quiet zone in Pocahontas County around the Green Bank Observatory. So 35% of students in Pocahontas County don't have a home they don't have internet in the home. So how are you supposed to do virtual learning without access to internet? So we spoke with Pocahontas County Schools and they applied for a USDA grant. I mean, they had to completely outfit Green Bank Elementary and Middle School with Wi-Fi. They had to buy every student and teacher in the county a laptop. I mean, that's a huge undertaking for such a rural Board of Education. They needed, in order to obtain this grant, up to $100,000 in matching from local foundations. So we said we would match up to $50,000 from any other organization so that they could get over that $100,000 threshold. They are still waiting to find out if they obtain that funding, but we are holding it for them. And then I would argue, and maybe it's because I live in a community like Lewisburg where the arts culture is so strong, but there's a secondary component of virtual education that to me is maybe not considered as essential, but is so important. You know, when we're going into 8 months of isolation and mental strain, arts and entertainment are incredibly important just to keep going. So we happily funded, for example, the Greenbrier Historical Society to help get some of their archives online, just so that folks could have access to that for some outside of school education components. And then we offered some basic operating support to some of these organizations. I come from a nonprofit development background. You know, when you cancel a Taste of Our Towns or a chocolate festival, that leaves a huge hole in the operating budget of a nonprofit. You know, not a lot of grantors will give operating support. They want to fund programs. So organizations have these major fundraisers to raise operating support. So we knew that we needed to provide some support there to get them through the year. And unfortunately, as Mayor Goodwin said, we are prepared to do so again. It's not looking likely that any major events are going to be happening in the next few months, so they're going to face this same challenge in 2021. So not to end in doom and gloom, there has been so much positive. I continue to be blown away by the generosity and resiliency of our community. You know, as I mentioned, food banks and food service organizations were like priority #1. Our max grant amount was $5,000, and any food bank that got the max award, but I had some ask for $4,800 or $4,700. And when asked, you know, do you need the full $5,000? No, I only need $4,700. Save that $300 for someone else that might need it more. I mean, that is how we are in Southern West Virginia. That is what makes some of our challenges worth it, because of the way that we look out for each other. And so I'm just so appreciative to live here. As Mayor Goodwin said, there's no better time to live rurally than during a global pandemic. And so I'm just appreciative of our communities, and if we have to start this fundraising and relief fund, start around 2, we're prepared to do that.
And great, thank you. So the themes I'm hearing out of you is that you all were kind of seasoned in disaster due to the tragedy of 2016, the flood in your region. But going back to the whole idea, is I hear a lot of themes from Mayor Goodwin to you is partnerships. The only way we get through this is together, so better together. And that the elements that are needed is for trust, transparency, and communication. Really the tenets of any type of experience as a team. And some are existing teams before this, and others were just kind of thrust into figuring out how to work together. So thank you for all that you do and the foundation are doing. We're going to be asking some questions of you a little later, so thank you. We're going to move to another great West Virginia community, to the mayor of the city of Beckley, the Honorable Mayor Robert Rappold, who will be joining us. And again, if you ever need him in a Gettysburg Address competition, he'll be on your team. So, Mr. Mayor.
You heard the first sentence of the Gettysburg Address, and I may need to brush up on the rest of it, but thank you, Paul. And thank you for the opportunity to be here today. And I'd like to echo a couple of comments, certainly by Mayor Goodwin, as well as Anne, on the importance of teamwork and the importance of community foundations, which during this period have shown just how essential they are. I'll just begin with a little chronology of how Beckley responded and how we've handled certain situations. At the outset, on March the 3rd, the city hosted a roundtable discussion with the Raleigh County Health Department, administrators of our 3 local hospitals, their infectious disease control specialists, first responders, emergency operations center, media, and other ancillary support representatives. And we felt by doing this early on to hopefully short circuit what we hoped would not become the pandemic it is today. We immediately formed that nucleus of teamwork of the important agencies, which has really gotten us through this tough situation. The purpose of the meeting was to gauge the awareness and preparedness of the community players to respond to the threat of this pandemic, again, that we hope would not materialize. But today, sadly, we know that the nation has reached in excess of 250,000 deaths, 250,000 deaths, West Virginia with 612 deaths and 11,000 active cases. On March the 18th, City Hall employees began working remotely 3 days a week on staggered shifts, and visitors to City Hall were screened prior to admittance and instructed to conduct matters in the lobby where possible, wearing masks and maintaining distance. Again, Mayor Goodwin's comments on being nimble and being able to respond quickly as situations evolve are extremely helpful. And like Mayor Goodwin, we pride ourselves on responding accordingly. Beginning on March the 18th, Raleigh County Emergency Operations Center initiated a conference call that at the time was 3 days per week, Monday, Wednesday, and Friday, with updates from the health department, the hospitals, the first responders, and all city departments. We've recently dropped that back to 2 calls a week and currently 1 call a week every Monday, but it's a great immediate real-time update. And I can't say enough about the Raleigh County Health Center, who really has their hands full at this point, developing these statistics and conducting contact tracing, et cetera. So our hats off to them. We certainly follow the governor's mandates, recent mandate on masks and distancing in all departments. Our recorder, treasurer, and controller have been very attentive to procedures required by the governor's office to qualify for CARES Act reimbursement funds that have been very helpful to our budget, which has suffered about a $3 million shortfall beginning in February, at the beginning of the pandemic. That $3 million shortfall represents about 13.5% of our budgeted tax revenue. Only Mayor Goodwin, about a fifth of what Charleston's is, but $20 million or $22 million, if it's not flowing as we'd like, is a big number. The Beckley Sanitary Board has reconfigured its customer window with limited spaced public access to ensure distancing and masks are required as we enforce by signs. Sanitary Board has also granted a ratepayers payment plan to ease financial burdens that may exist. All city departments have been instructed to postpone all elective capital expenditures until our financial forecast becomes more predictable. Several retirement and attrition situations created personnel vacancies that have not yet been filled during this period unless considered essential to operations. And to address Mayor Goodwin's comments, I guess we consider essential employees as those who provide during this time, at least the bare minimum of what our taxpayers expect in terms of services from public works and certainly police and fire. But that's how we look at, that's how we consider essential employees. Common council members and those wishing to speak during public hearings or at a public comment time do so via Zoom or by telephone. There's no admittance to council chambers by the public except the mayor, recorder treasurer, the city attorney, and our recording secretary during council meetings. Various authority and EDA meetings, as I'm sure everybody is experiencing now, are also conducted via Zoom. The city sponsors a number of events during the year, most notably our Chili Night, which is well over 30 years old now and attracts 10,000 visitors to downtown Beckley. But those, along with other events, have been canceled for this year. The Halloween Trunk or Treat event, which is wildly popular on the top level of our intermodal gateway, was canceled this year. The Fall Street Fair and the Taste of Beckley and other festivities have been canceled. In the case of parades, we have a reverse Christmas parade where floats are parked in a large outdoor arena and cars drive by slowly to take in the sights. The city has participated in and fully supported 2 marches through downtown and a church service in observance of protests and unrest in other cities. All events were solemn, dignified, and participants were appropriately masked and observed distancing. Dr. Amjad, the State Director of Public Health, West Virginia Tech, the Beckley Raleigh County Chamber of Commerce, and the City of Beckley formed an alliance to post "Wear a Mask" placards in businesses and offices, and to place a number of 4x8 banners in high traffic areas, which is a constant and forceful reminder to wear a mask. Beckley City Chamber of Commerce has launched a well-designed program espousing the merits of relocating to our area in terms of lifestyle, natural beauty, low cost of living, taxes, and this is all enjoyed by performing their jobs remotely here in southern West Virginia. We've already seen some results from that alludes to Mayor Goodwin's comment, having met a friend who had relocated to a parent's home during this event without missing any work time. So that's what we're shooting for. One situation that we're extremely proud of, beginning back in March, our food and beverage service at the historic Black Knight Park, formerly Black Knight Country Club, which the city purchased about 2.5 years ago. During this pandemic, a 4-month period, prepared and boxed over 10,000 meals for the Raleigh County school system, beginning with their summer feeding program and then continuing on as the summer turned into early fall. So that worked out well. It was a nice boost to the public and to those parents and children who may have had doubts about meals on a regular basis. And frankly, it allowed us to keep our staff who otherwise would have been furloughed, to keep them on board to prepare these meals. So it worked out really well. So in closing, I would say that COVID has certainly placed a daily cloud over all of us. The ground rules to combat and prevail necessarily change with conditions frequently. As leaders of great people dedicated to the survival and success of our communities, we should radiate a positive, disciplined, and determined attitude, and we will all succeed together. So thank you very much, Paul.
Thank you, Mr. Mayor. I just want to kind of note on a couple themes there that you brought out in the conversation is that, you know, there's honest and difficult decisions being made. We heard a lot about the budgets being taxed, looking at staffing, being able to recalibrate and use the resources available at a city to serve other needs. We heard about that transition to the Black Knight Country Club food service serving the school system. And also I kept hearing the theme of partnerships, again, coming across. There's a partnership about wear a mask with the state health department, the county health department, chamber of commerce, the city. So just tremendous, but then also looking at innovative solutions. We're hearing that theme from the mayors about ways to attract folks and or using new platforms such as not losing historic community events, but making them physically and a health-wise distance, but doing that drive-through parade concept where everybody's in their individual cars. So there's a lot of big, bold things and decisions being made that will probably fine-tune what we do in the future. So thank you, Mr. Mayor. We're going to go back from city government and transfer over back into philanthropy of a different type of foundation that's a very critical foundation. Janell Ray is the CEO of the Pallottine Foundation of Huntington and Executive Director of the Pallottine Foundation of Buckhannon. Two different foundations, but tied by a common matter of a healthcare conversion foundation, there was a historic hospital locally owned by the Congregation of the Pallottine Sisters, which was sold. And because of their commitment to the community, those assets were moved into a foundation to benefit the regions that they serve. So one is located in central, the Potomac Highlands part of West Virginia, the other one's over on the Kentucky border. And they're doing tremendous work because of their history in health. And I'll turn the floor over to Janell.
Well, thank you, Paul, and thanks to all of you for all the work that you all are doing. You gave a great summary of what our foundations are about, Paul. Just so that you all have a frame of reference, in our Buckhannon Foundation, we serve Barber, Lewis, Randolph, Upshur, and Webster counties. Our Huntington Foundation really serves the tri-state region. We serve 9 counties in West Virginia, 8 counties in Kentucky, and 3 counties in Ohio. So that creates some challenges for us with a large region like that, especially during a pandemic like this. So kind of building on what I've heard, especially from you, Anne, I think the key word that has really guided all of our efforts since March has been flexibility. We've had to be flexible with our staff, and you know, everyone is working from home. Well, I'm in my office now, but everyone's working from home. And we have been since then. So that's created some challenges as we've looked at, you know, how we can help our nonprofits when we're all separated. And it's the same that, you know, all organizations have had to deal with, but especially in our Huntington Foundation, trying to reach out to 20 different counties and understand what the challenges are. It's been a challenge for us as well. We've learned how to do it effectively. I know that we're all looking forward to the time when we don't have to do that anymore. But more, I guess, equally or more important is being flexible with our organizations that we fund. One of the first things that we did was we waived reporting requirements for our grantees. You know, part of our due diligence, you know, and fiscal responsibilities is following up with our awardees, and you know, they have periodic reports to submit. So we said, no, you know, we'll submit it. You can submit a final report at the end of the term. We understood the challenges that organizations were struggling with. We extended for our new grant cycles. We extended the deadlines. We gave organizations extra time to submit those applications. We created a separate COVID emergency grant process in both of our foundations, and we were able to get that out very quickly. It was a streamlined application. Didn't require the same level of detailed information that our normal grant applications required. We had special board meetings. Our boards were very, very supportive and helped us with really quick approval so that we could get our funding out to the organizations that really needed it. One of the things that we did, and Philanthropy West Virginia was a part of this, we started meeting as health funders and other funders across the state. There's a group of West Virginia funders that only focus on health. And so we convened weekly meetings with those other West Virginia health funders, so we could learn what other foundations in the state were hearing. We leveraged partnerships, again, to use that word, Paul, partnerships. We worked together to fund different needs across the state, trying to ensure that the whole state was covered by one of our foundations. You know, we looked at how could we support the county health departments, who we all know have been slammed. So we worked really hard with that. We brought in speakers to help educate us so that we would truly be able to understand what the needs were. We had speakers from both of the food banks. We had speakers from the Department of Education, because as we all know, how to keep feeding our kids was a challenge. We had people from senior service organizations, because that was an issue as well. United Ways came and spoke to us, primary care associations, the health departments. All of that helped us to be better prepared to figure out ways that we could get our funding awards out to organizations that really, really needed the help. Going forward into the end of 2020 and 2021, we decided we're not establishing another COVID separate cycle, because what we've learned through our recent normal cycle, almost every applicant that we've reached has some kind of COVID impact. And so they're including that in their grant applications for us, so that we can really start to really get a handle on what the impact on these organizations has been. The nonprofits are really, really struggling, and we feel like it's our role as a foundation to partner with them to help address those challenges. And you've talked about decreased donations and fundraisers not happening, that type of thing. A couple of other things that we're hearing from our nonprofits partners are they've lost lots of volunteers. They don't have volunteers anymore to help them in their work. A lot of volunteers are seniors, right? They're retired, and so they're able to do that volunteer work. So as a result of that, the staff that are having to deal with really an increased level of work because of the pandemic, they're suffering from burnout and just high levels of stress. And so we see an increasing need for mental behavioral health services, and not just for staffs of nonprofits, but just in general, because we're all dealing with those really high levels of stress. So that's going to be a focus for us going forward. Our foundations together in this last fiscal year, we funded about $3 million just in our total grant awards, but about $450,000 was purely COVID related. The types of organizations that we funded were food banks, health departments, homeless shelters, city missions. We provided funding for a quarantine center for homeless that were suffering from COVID or were at risk of suffering from COVID. Senior centers, we made that a real priority for us. What else can I tell you? I think going forward, as a positive, kind of to close like you all have, on a positive note, the level of collaboration that we've seen since March has just been awesome. And it's with our other foundations, which we've always had, but it's with our nonprofits that we've been funding, working together with them, helping bring some of them together to work on projects. I'm going to give you one really great example, and then I'll close. But we worked with West Virginia VOAD in both of our regions on a really cool project. What we did, we funded West Virginia VOAD, and they in turn provided funding to restaurants, which we can't fund because they're not nonprofits, but they funded these restaurants to keep small local restaurants, to keep their restaurants open and their employees paid. And the food that they provide went to or to groups that needed it. So it went to senior centers, it went to the city missions, it went to the parish house in Upshur County. So we really like that example because it was a way to really bring partnerships together, right? It allowed us to, we called it a twofer, right? So it helped small businesses stay open and provide, much needed food to people that were really struggling. So we were so pleased to be able to be a partner in that type of program, and that's what we will look for going forward.
Janell, thank you so much, and for all the impact both of your foundations and you and your team are doing. Again, want to recap some things we heard there. Flexibility is a big key theme, I think, for all of us. But also the fact that from Philanthropy is lessening its practices as far as the reporting, not quarterly, but making it once a year, being respectful of where everybody else is and understanding their challenges and trying to free up some of that burden so they can activate and do what they need to do to respond to need. And I heard a lot of strategy in there, kind of adaptable strategy. Talking about being strategic with investments, identifying gaps, coming in with the resources that Philanthropy could leverage, public funds, whether they're federal, state, or local government, as well as with companies and others. And then that collaboration muscle. And Janell, I don't know if you said this in a past conversation we had, but like if we could all keep this collaboration muscle going after the pandemic, this could you imagine what we can do across our towns, our counties, our regions, and our state, really to take us to the level we went to. So again, thank you for all that you do and all the creative insights and expertise at your foundation. I'm going to move over to our fifth panelist, the distinguished and honorable mayor of the wonderful city of Lewisburg, Beverly White. And Beverly, Lewisburg, you've got one of your partners. So great to have you with us and share your leadership experiences and for your community. The floor is yours. I think you're still on mute. See the bottom left-hand corner usually.
Okay.
You're great. Thank you.
Okay. Thank you so much for inviting me this afternoon, Paul, and to all the other distinguished people on the panel. As I sat here and listened to everyone, I'm like, this has been a lot since COVID started. And the first thing when I became mayor, that's when Lewisburg we had a mayor and now we have a city manager. And before that, our mayor was our city manager. So we started with a whole new system of how we were going to run the city. And the first thing that happened when COVID came and we knew that it was going to be an issue, my city manager said, well, first of all, the governor said, anybody 65 and older, you need to stay home to be safe. If you have a compromised health issue, you need to stay home. So my city manager said, Mayor, I know you don't look it, but I said, I know, I'm going home. So I did go home and retreat. I did do the test and, quarantine for 14 days. But my city manager and our treasurer, they took over the city of making sure the day-to-day responsibilities got done. We made sure that our employees were safe first, and that was very important to us. Our public works people, we worked out a schedule to where people wouldn't be, together at different times. We did the mask, that was mandatory, and we let them know if there's two in a vehicle, you will both wear your mask. If you're by yourself, you don't have to. All of the business of the city continued. We have a drop box where people could make their payments, and our city manager and treasurer, they did all the mail all those days. And so when we felt it was safe enough for our employees to come back into the building to do their different day-to-day things, that's what we did. Looking back, there was so many people that were helping the city of Lewisburg and the surrounding areas. We're very grateful to the foundation and to United Way. We had a young lawyer, Jennifer Mason, partnered with Bimbo Coles and Company to deliver meals. And by getting donations, that money was paid to restaurants to fix the meals so that the restaurants stayed in business. And each one would take a different day to fix the meals and have them delivered to our seniors and to anybody that was health compromised. And that went on for months. Our fire department also helped deliver those meals. And as you say, who's essential? Everybody's essential. We just have to figure out who can be among the public and who can't. We shut our doors to City Hall, and because we didn't have the ability to have people come in and screen them and all that. They're still closed, but the business of the city's being done. Our building permits are up. It's been amazing what people decided they needed to do during the pandemic. We had 4 new businesses that opened up downtown during this. Our greatest sadness is that we couldn't have the literary festival. We couldn't have the chocolate festival. And those people that are impacted, our hearts are out to them, because it's like, how do they continue? And we're praying that in 2021, all of those things can happen. We canceled our Christmas parade. The Shanghai parade has been canceled for the first time, I think, since the war. Just trying to keep people safe. But we're celebrating magic, Christmas magic in downtown Lewisburg. Our business owners are making sure that when you come in, you have a mask, they have hand sanitizer. So we're trying to do all the CDC guidelines of keeping people safe. We're excited about what Christmas magic downtown will look like. Kids are sending their letters to Santa, and we're trying to get those answered for them. So we see a lot of movement downtown, and that excites us, that people are still coming. Our rate has been low, and we think that's why they feel safe. We have seen RVs at the fairground because they have their campers, so people feel safe coming to our area. Going forward, our Public Works Department, they have a schedule where so many people will work this day, so many that day, so that the city services are still continuing. And everyone has just been outstanding in trying to do what we've asked them to do, so that, you know, we minimize the number of cases that we have. And I'm very pleased with the fact that we could still pay our employees when they were off. Nobody lost their benefits or anything like that. And you know, so many things have happened. As when I became mayor, we had to deal with the racial tensions and the COVID, and just, you know, just trying to make sure that we stay positive and keep encouraging each other.
Thank you, Mayor White. I want to highlight some of the great comments you had there and the tremendous leadership you and your team have. At the very beginning, you talked about safe employees, people first, ensuring their safety, as the others have mentioned, but really being focused on that, being honest, and your strategy and your approach of closing and canceling some things, but then accommodating, and then also knowing that the downtown is still a major commitment. I heard you referencing resources to the businesses, even in product with masks and hand sanitizer, and then also ensuring what other support can be leveraged there. And again, the theme from all 5 panelists is partnerships and collaboration is the only way to get through this, is to get through it together. Thank you so much. You know, look, the great input we've had from folks, from the panelists and such, and I would invite those participating, we've got 55 some on here, is that if you have questions for the panelists, to please drop those into the chat. I know Sarah might get some as well to share over with us, and she'll pop in if she has anyone send to hers. But I got a few to start us off with. You know, you're leaders, but you're not the mayor the full time, the leader of the foundation full time. This is a very challenging process for you professionally and for you personally, just from all the changes we're all going through. I'm interested as leaders, what have you learned about yourself and your community or foundation during this time? And I'm going to start with Mayor Goodwin first, as she went first last time.
You know, I'll say this. I think that I wrote down, as I think you did too, Paul, all of Mayor White's exceptional comments. You know, all mayors across this state in this country want to flip all the lights on and throw the doors open, right? There's not a mayor in the country that wants to turn off lights and shut the doors, I promise you. But it takes actual hard decisions. And I think what it shows about what I heard today from mayors, across the state is that, you're put here to, Mayor White was put there to make tough decisions. It is difficult to cancel and to shut the doors on something, but our number one job and our biggest priority for all of us, and I know this because I know the other mayors personally, is keeping people safe. And so I think that leaders lead during really difficult times. It has been a really difficult time. It's taught me that we certainly can, as West Virginians do. We do more with less. As Ms. Ray talked about, communities, when we feel like we need each other, we Velcro each other to ourselves. It is that initial push. So it's a constant reminder of our good hearts, but also looking at leaders like Mayor Rappold and Mayor White, that during difficult times, leaders have to lead and do what is, unfortunately, not always popular, but these are the right decisions, and those mayors made the right decisions. And so it gives me great peace to know that we have a sign actually in my boys downstairs, they don't like me to call it a playroom anymore because they're 16 and they think that sounds too babyish, but you know what I'm talking about. It's their rec room or whatever. And there's a sign that says, "We can do hard things." And you can do hard things. It's difficult, but you can do it.
Thank you, Madam Mayor. From perspective, you shared great expertise from as your community. For you as a leader, anything in particular that stand out for just your own leadership experience? You've led major organizations in the past and divisions of government. Just anything that stands out for you personally as you reflect back on what's been now almost 8 months?
Wow. Yeah. I'll say this. I think that people also follow, a leader's charge too. I think that, if we're going to walk the walk or talk the talk, we better walk the walk. I promise I'm by myself in my office. That's why I don't have a mask on. No, I'm not going home for Thanksgiving. My mom is in tears. I haven't seen my parents for a calendar year because my father has pre-existing conditions and recovering from cancer. I think that when you do it, the next person will do it, and the next person will do it. And I think that strong leadership and people have to do those tough things, not just say it, right? It's easy to say, right, Mayor White? It's easy to put out a press release. It's easy to do those types of things, but putting your money where your mouth is, it's really, those are the types of things that I'm proud of our community, because, yes, our name is on the door, and yes, our name's at the top of the letterhead, but there is no way that anybody runs a city by herself or himself. We certainly don't. And I have super blessed, but people are really engaged and involved. They want to, nobody gets into public service, right? Or philanthropy, right? For any other reason except I want to do better. I think I can contribute something, and I want to do better. So I think that we've shown that about who we really are at the end of the day. West Virginians can make a dollar go a really long way. We can take something and make it special. We're good at that. That's our heritage. That's our history. We create and we craft things into something special.
Well said, Mayor Goodwin. Thank you so much. You lead by example, and then you live that bond and that commitment. So thank you. Same question, Anne, for you. So as leaders, what have you learned about yourself and in your case, foundation?
Yeah, thank you. Particularly in this situation, the importance of delegation, passing things up. I am one person staff. So our role as community or private foundations or United Ways, we want to try to plug all the holes and do all the help in every way we can. But an important part of COVID relief was acknowledging, communities and schools is going to take on part of the feeding program. Let's let them take charge of that. Greenbrier County Health Alliance has someone that's making masks. Let's let them do that. Just the importance of, passing tasks. Not that I was in charge of passing out those tasks by any means, but not trying to do it all. Find what we need to do in the community, and for us, that was a role of funders. And then just connecting those. Oh, you're looking for masks, go to Greenbrier County Health Alliance. Greater Long-Term Recovery is helping with the meal program. That's who you need to talk to with that. And that's kind of a role that a community foundation unofficially takes on, is kind of a conduit, sending people in the right direction. Who needs you, and what can you offer? And these are the people to go get that from.
And thank you. For Mayor Rappold, for your perspective, going back to that same question, what have you learned about yourself and your community?
I guess first and foremost, I've learned about myself the ability to hopefully communicate effectively without the benefit of in-person meetings. But more importantly, I think it's been a revelation to me just how incredibly talented and dedicated these departments and agencies that we deal with on a daily basis, but not so much when the chips are down like they have been. And to see organizations like the Raleigh County Health Center, our EOC operations, our first responders, police chief, fire chief, their entire departments, our human resource department here in the city, our financial people here in the city, when the chips are down, they go into overdrive, and they show that not that they ever have to prove themselves to me in any way, shape, or form, but they prove that not only do they handle the day-to-day detail, but when things are tough, they have this incredible ability to think and to push forward and to make good things happen. And I think, to me, learning that has been a very gratifying, positive experience for me. Thank you.
Thank you. Janell, same question. I'm happy to repeat it if you want me to.
Yeah, that's okay. So I think for me, our team is so much smaller than cities that have big staffs, but the takeaway is still the same, right? Our team is pulled together, worked extraordinary hours without complaint. So just that sense of commitment to the mission, commitment to the community has just been wonderful to see. And then you can take that and you can apply that to our nonprofits that are doing the same thing. And so when I think about what, as a foundation, what our role is, and Anne touched on this, but to serve as connectors in the community, to help pull those resources together and make those introductions. The role of a foundation, whether it's a community foundation, a private foundation, is really to help facilitate and help coordinate efforts. It's more than just providing dollars. It's providing access to other organizations, and so seeing, which has just been wonderful to see, and it's not surprising, but it's wonderful to see how well all that has happened since COVID.
Thank you, Janell. Madam Mayor White?
What I've learned about myself the most was with the racial tension. And we have a statue, so forgive me if I get emotional. We have a statue that's headed out of town that says, in memory of our Confederate dead. And when all the racial tension started, it was like, we gotta pull that statue down, we gotta pull. And my take was, let the dead be dead. Let us move forward with education. Go to the North House Museum and see the exhibit, Echoes of Slavery. I want to teach children how to treat people. I'm not discounting history at all. History happened. We can't change it. And I made the decision, we're not moving that statute. We're going to educate people on history and how that changes our lives. And I got backlash from people that said, why don't you take it down? I said, no, that's not an issue. It doesn't bother me because I'm sitting in the mayor's seat. So whatever happened back then, I've proven that we can move forward, that people can change their ideas and minds about how we treat each other. And we had a protest of 250 to 300 people, a peaceful protest of us standing together. And at no time during that protest did anyone say, take that statue down. It is a sore spot for a lot of people. The Black community, it doesn't bother them because it doesn't define who we are. And so during this pandemic, that has probably been the hardest thing, was to stand my ground of it's not going to be moved. We're going to move forward educating people. And that's where it lies in what's being taught at home and how we treat each other. And to trust our employees to do their job. And I promised I would lead with love and respect, and that's what I continue to do.
Madam Mayor, it's a tremendous sharing of your values and your style, as well as the trust you're building in your community. Thank you for what you do there. And I love how you referenced, let's educate people and build it anew, build it to where we want to be from this. Thank you so much. We've got a few questions coming in on the chat, and I want to make sure we attend to those. So I'm going to move away from our pre-prepped questions. And so one of them was that Sarah passed over is, can you talk about the first responders in your town, your city, your county? How are they doing, and do they have enough PPE? And I will start. Mayor Rappold, do you mind going first? You're still on mute.
Good. There we go. I'm sorry.
Oh, there you are.
Wrong button.
Okay.
Our PPE situation is very adequate. Again, these weekly calls allow our first responders the opportunity to place orders for required PPE. And for some time early on, there was a shortage of whether it was masks or gloves or sanitizer. But recently, and more than recently, in the past 3 months or so, we've been in good shape. The big concern that I have and I think about frequently is the fact that all of our 43 or so sworn firefighters in 3 different fire stations in Beckley are also EMS qualified. And we have recently struck an agreement with the local dominant ambulance care company to often become the first responder even ahead of the ambulance, depending on the location of the call. And that has in the past and on a daily basis, because nursing homes are kind of hotbeds of the active cases, and in several instances, firefighters have had to administer CPR, and obviously are very close to the patients during that time, but they take all precautions required and necessary. And I'm really proud of the training they have and their dedication to duty. But that's the only spot I think that keeps me up at night occasionally, is concern about the health of those who are truly first responders and very definitely in a difficult situation as far as contagious disease goes.
Thank you, Mr. Mayor. Mayor Goodwin.
You know, just to take off on what the mayor said, yeah, I mean, PPE is certainly something that I think the bells were ringing loudly in the beginning, and so that was something that was difficult, I'll be quite honest, especially here in the city of Charleston, extremely difficult to get our hands on. So we were we were fist fighting to try to get whatever we could to keep our first responders safe. I think everybody in the state of West Virginia, actually everybody in the country, we know that was an issue. And so that has kind of eased up a little bit. The challenges that we face are not necessarily PPE, is that making sure that they have enough equipment to take care of them, because what keeps me up at night, Mayor, is actually when one, because we've had this in the city of Charleston, if one firefighter gets COVID, that typically means then his partner, then his station, then who shares the same truck. And so then that is not one, now you've taken 6 of our firefighters and first responders out of this pod, and then we have to reshuffle the deck to see who can respond. So that is the thing that makes me worried. And in the beginning of the pandemic, which is also good to say now, I think more than ever, because the state is on fire currently. You may not be able to feel the warmth yet, but it is on fire. I can promise you that it is. And we're going to see a huge spike again. Is that when we're saying to you, we need you to work from home, because it's also because I've got to keep our folks safe. Mayor Rappold has to keep his folks safe. Mayor White has to keep her folks safe. And the more that you're out and the more that you're not socially distancing, you're not wearing your mask, then that puts our first responders in jeopardy as well. And because those 911 calls need to be answered. So that's what keeps me up at night. The PPE is there, but just making sure that we keep them protected and have them wear a mask. This is an industry that when you're pulling somebody over and you have a mask on, it's really hard to communicate during the really difficult situation. You ask any police officer with a mask on, that's really tough stuff that they're doing. So I think I answered the question, but added a little bit.
No, that's actually that was another question. So you're actually, both of you are answering 2 first. So carrying on the tradition. Mayor White, from your perspective, you come in this a little bit, but just from the standpoint of PPE and the safety of essential workers.
I think our PPE is where it needs to be to protect our police officers and our fire department. We have in place schedules and ways that if this happens, then this happens. So they've really did their job in the what ifs, and it's worked very well. We've had some close calls, and we've been able to make sure that everybody's covered and the city's covered with the precautions that needed to be done. And everybody, if they have to work overtime, they do, and we're very appreciative of that. And they know that we're not playing. If you test, you will not be at work until you are safe to come back. And that's been the main thing, is making sure that our employees understand you cannot work if you're not safe to work. Because like Amy said, you can infect the whole department, and then what happens to the city? So I feel we're in real good shape with scheduling and how we need to do something should we get hit.
Thank you, Mayor White. For those in the foundation space, I'm looking very respectful of there's a question from it. There's a couple other questions that have popped up that we're not going to have time to get to just because we have a hard stop at 2:15. So if some of the panelists want to pop in and respond to James Young's question, but I do want to pose a question to our foundations. You all are working with different entities as well, helping with PPE supply. So first point is, are you seeing a need for PPE beyond city governments and other spaces? The other question is, how do you envision your support with COVID going into next year? Janell, you kind of touched onto that already, but just would like to hear from both of you again, PPE supplies, and how do you see your COVID response in 2021?
So we just recently funded this week PPE supplies for probably 10 of our county health departments, some in Kentucky, some in Ohio, and some here in West Virginia. So we did receive a request from them stating that they had that need. So I think there's some of that still out there. And the second part, what was the second part of the question?
How do you see your grant making for COVID related efforts in 2021?
Yes, so yeah, and I did touch on that. We've incorporated those types of questions into our normal grant making, and not having a separate initiative for that.
So still addressing COVID, but just knowing it's a core part of every application that's coming into the
Correct.
health funder.
Correct.
Thanks, Janelle. Anne, for you?
Yeah, we haven't gotten a request for PPE funding in quite some time, particularly not for a first round of funding. So things seem pretty good there. In 2021, in terms of relief, I think we're going to be focusing a lot on operations support. Organizations that have missed out on their big fundraising events, we're going to try to step in and help with that if we can.
Thanks, Dan. I appreciate it. I'm looking at schedules. It's just approaching 2:15. I do want to take a moment as realizing the hundreds that we've lost in West Virginia. There's tremendous good work going on, but we have to be in touch with the reality as we go into next week and just be mindful of the impact it's had on individuals, but also the amazing amount of essential workers, physicians, public servants who are doing tremendous work. So we just want to go into with Thanksgiving for all of the panelists for their work, and also during this time of remembrance to honor those that are still working and those that we've lost. So with no further questions and time, I thanks to the panelists. So a round of applause to all of them for their tremendous work and for being with us today in the midst of this craziness. And I'll turn it back over to the Small Communities Big Solutions team and Sarah. Thank you all.
Thank you.
John.
Thank you, Paul. What a great moderator. What a great panel. Mayors, foundation leaders, thank you very much. I think that from a West Virginian standpoint, we know that there are struggles and challenges facing our local communities and towns, but to kind of, you know, look up the curtain and see what's really going on. And you've showed us that today, the challenges that you're facing in leadership. So thank you for taking time out of your busy schedule to kind of update West Virginians, and so that we have a better understanding what's really taking place in our communities across the state. And so we will wrap up this session. We have one more session to go today. It's on how West Virginian women are moving forward in West Virginia, and it's on a different meeting link. So we will see you over there in about 10 minutes. Thanks so much, everyone. Please stay safe.